Annette, thank you so much for coming today.
You're welcome.
I really appreciate your time. We're going to treat today with the SPLENDOR X.
Yes.
So you've had the SPLENDOR X before.
I have.
So we've been treating your face, and you've had some good results. But I want you to tell us a little bit about why you came in for treatment in the first place.
Okay, I came in because I was so tired of shaving. My hair just continued to grow and grow, and it was coarse hair, so especially under my chin, I laugh a lot. So when I lifted back my head to laugh, I was like, oh no, I still have hair. So, and shaving was causing bumps also under my chin, so I decided to come in to Dr. Diggs.
And I appreciate that.
Yes.
So we've treated you several times,
Yes.
And so now, how is the hair growing?
It's growing so well, and the hair under my chin is gone. It is
Totally
like
gone.
It's like literally gone.
So when was the last time you shaved or plucked?
I don't anymore.
Don't anymore.
Yeah, I don't anymore because of this machine. I mean, and you, of course, Dr. Diggs, but it's really been a blessing. It really has.
So we are going to treat your face again today,
Okay.
just to try to get any of those little thin, persistent hairs that are remaining.
Sounds good.
But we're also going to treat today for the first time your underarm area.
Yes.
So how often do you shave your underarms?
Every couple of weeks. Yeah, I shave every couple of weeks just to make sure. And I didn't want the discoloration that was under my chin also to proceed under my arm, but I think it has happened, so I'm excited about this treatment.
Yeah, so looking under your arm, you have black coarse hair, and you do have some of that low-grade hyperpigmentation or darkness that happens from chronic shaving over the years. So this is an excellent machine to treat that because it tries to avoid that top skin color and go deeper to the color that's in the hair root.
Okay, perfect.
So because this is the first treatment for your underarms, we're going to use a lower energy, just as I did for your face.
Yes, you did.
And then as time goes on, we'll move the energy up to get those leftover hairs each time.
Okay, sounds good.
Any questions today?
No questions.
Okay, good. We will treat.
Okay, thank you.
The SPLENDOR X has a very ergonomic handle. So it's very easy to use, it's nicely weighted, and there are a couple of key things about the SPLENDOR X that I really enjoy using as a practitioner. So one, many of the things we use with laser hair removal, like cooling, an evacuator to bring the smoke into a machine and out of so you don't smell it in your nose, those types of things, we used to have a separate machine for each one of those. But with the SPLENDOR X, it's all in one handpiece. So there's a contact cooling that chills the skin just prior to treatment. It has a smoke evacuator built into the handpiece, so it takes the smoke away right at the point of contact. And then it has this component, which is sort of the size. This is an 18 millimeter, which we'll be using today, but there are various sizes to use depending on the target and the type of skin that you're treating. And then it also has a Zimmer or cool spray that shoots out right from the handpiece onto the skin. It serves both as a chilling agent, but also it's a little bit of a distraction for a patient so they have less pain. Prior to using the SPLENDOR X, I used to use a lot of lidocaine numbing cream on patients prior. I still do that, especially in the beginning when there's more hair to treat. But it really is so much more comfortable that most, I would say 80% of my patients don't use any numbing prior to treatment because of the contact cooling and the Zimmer cool spray that shoots out just as you're treating a patient. So with the setting that we're using today, which is for a Fitzpatrick 6 skin type, thick, dark, coarse hair in the underarms, we're going to use program 46. It walks us through it to get to this point. And then we're using the 18 millimeter spot size. I always double check that. A rep rate of 1. The fluency, which is pre-selected based on the parameters the software walks you through, is at 11, which is 40% of the range. So with each repeat treatment, you can go up. And then the pulse duration is 20 milliseconds. And then the smoke evacuator, you can set to the setting that you like. I generally like 5. Everything on the screen is touch screen. It calculates the number of pulses that you're taking. At the end of a treatment, I generally have my nurse take a photograph of the screen for the record in my electronic medical record. And then it has several safety measures which I really appreciate. One is that there's a standby and then you get it to ready. If you don't use it for a while, it automatically goes back to standby, which is very good, so you don't accidentally treat or do a pulse unless you're really ready to treat the patient. So I actually like that. So let's see. First, we all have to have on goggles, and I always check the wavelength will be on the goggle. So I'm using a 1064 YAG on the SPLENDOR X today. So I've already checked my goggles and my patient's goggles to make sure we're using the right ones. If you have a lot of lasers in the office, sometimes they get mixed up, so you should always check that. So our laser asks us to confirm that everyone has goggles on, everyone's protected, and then when it's red, it's ready for treatment. You can hear the spray starting to come out of the machine, so I listen for that sound. And then I turn on the dimmer, which is another spray, and I can actually feel it. And then we get ourselves ready to treat. There's a foot pedal that's positioned, and everyone goggles on in the room, and we're ready to treat. So Annette, we're going to do our first call.
Okay.
So you'll feel a pop. So what I look for is a little bit of crinkling of the hair. And this laser can go very quickly. I have it set to 1 hertz, but it can go much more quickly as if you're painting an area. So each time I treat, I can see a little bit of crinkling of the hair, and I smell hair, thin smell. I just heard a little pop. I listen for that. Prior to treatment, a test night was done, so I already know that this energy works well for Annette. I'm looking to make sure I don't see any really rapid, quick redness. I don't see any redness actually, none at all. I'm listening to make sure I don't hear a very, very loud pop. So I take my glasses off just to check. And it looks great. So you'll see hairs that are a little bit frosted looking, and that's coming from the heat. You may start to see some slight puffiness or edema just at the base of the hair, but no intense redness. So it's perfect. How did that feel, Annette?
Wonderful.
Good?
Yes.
So no problem. She
No,
has on no numbing cream.
No.
All of her pain control is coming from the contact cooling and the cold spray.
Yes.
So next we'll treat your face, which has been treated before.
Yes.
I'm going to increase the energy because she's already escalated and has had a very effective treatment with the higher energy levels. And we're trying now to get the thinner hairs, which actually require higher energy, and the resistant hairs. And then it'll ask us to confirm that we all have goggles on. You check your room, make sure everyone's got your goggles on. You listen for the cold spray. You should hear, the person. I actually use all my senses when I'm doing laser. I'm smelling, I'm listening, I'm looking to make sure I'm giving the most effective treatment. It actually looks great. I don't see much hair actually, but I can feel a little bit and I can see some wisps. The place where people usually have the most resistant hair is usually right here. But as Annette told me earlier, she actually doesn't have any hair anymore. So I can use the contact cooling right to her skin, and then I can shift to make that the first area of treatment. You'll feel a little pop. I'm looking at my squares. You see the light, so it helps me map where I am. So for the contact cooling, you can reverse it each time so that it cools the area that you're about to treat next. You want to try to have these 2 points flat at all times. If you're over a curved area, sometimes I'll just sort of make sure that I'm aware of the plane because you want it perpendicular. You can rotate again, cool, then begin. Great results. So I could smell a little bit of hair, even though earlier I couldn't really see it, but I could smell that finer villous hair. I can smell a little bit, see a little bit of crinkling. She has a slight hint of erythema, but looks great. Looks great. How did that feel?
Good.
Good. Okay, good.
Yes.
Well, thank you so much, Annette.
Yes, thank you.
Really appreciate your time being here with us today.
Thank you.
We are here to talk about the SPLENDOR X today. So the SPLENDOR X is an excellent laser that has two lasers on it actually. A neodymium YAG laser, which is 1064 wavelength, and it has an Alexandrite laser, which is 755 wavelength. So this machine has a touch screen. The software enables you to just go right through as you're selecting what you're using on a patient. So today we're talking primarily about laser hair removal. And so in skin of color, Fitzpatrick skin type 4, 5, and 6, people who either have browner skin, who have an ethnicity that has higher pigment levels generally, or someone who, you can even use it sometimes in someone who has hyperpigmentation from tanning, so their skin is just a little bit darker as their new normal. You can use just the YAG laser. So I select YAG laser hair removal, confirm. It asks you if the person's tan or not, absent, and then it asks you for their skin type. So the person we're treating today is going to be a skin type 6. So we'll select 6, confirm. It asks the hair color, and the answer is dark. There's only one choice, because if you have a lot of color in your skin, you also are going to have a lot of color in your hair. And then it asks you thin or thick. So that depends obviously on the area that you're treating. So sometimes on the arm, you'll have thinner hair. Chin stubble may be thicker. Groin hair, genital hair might be thicker. But also, once you've treated someone multiple times, as the hair regrows, it regrows more thinly. So as you advance through your treatments, you will select a thin thickness of the hair. Today, we're selecting thick, because this will be our first time treating our patient. And then it gives you your selection. So as you use this machine over time, you really start to memorize the programs. So this is program number 6. And it presets all of the parameters for you. I really love this because in addition to me treating the patient, and I've been doing laser hair removal since 1995, I believe, you can also really easily train your staff to use this machine because the software walks them through it. So at this setting, it gives you some suggested parameters, and you can stick with this program, number 46, every time you treat a patient and just slowly increase the energy level. So this starts at a fluence of 11 joules per centimeter squared, which is 40% of the range. So then the next time you might choose 45%, then 50, then 60. You keep escalating depending on what the patient is experiencing. So for this patient, we actually have already done a test site. So we know that her skin reacts well to these parameters. So today we're going to do a complete treatment on the underarm area, which has never been treated. She has thick black hair and also some low-level hyperpigmentation from shaving over many, many years. So when you first treat, we treat a site and then wait and look at some of these specific indicators about whether it's working well or not. Things such as, do you see immediate crinkling of the hair? You can actually smell a little bit of the hair. I'm listening for a pop sometimes when I'm treating, and then you see the result that becomes delayed. I don't want to see immediate redness. I want to see really not a lot of erythema, particularly in someone of color. And then I might see some delayed edema just around the base of the hair follicle, perifollicular edema. And that usually should happen several minutes later, not right away. But that is actually the perfect result. So many times it can be difficult to see inflammation in the skin of someone of color. So you're really not looking for a lot of redness. If you don't see that, that is okay. Start with this parameter and then move up slowly. With time, as you get more comfortable, then you can start to increase the energy levels as the hair starts to change. So over time, with each treatment, you see results. The hair will grow more slowly. It will grow finer, more like arm hair. And you'll see areas that have no hair at all. So you'll see areas where there's some persistence and areas where there's zero hair. So they have less hair overall.
The circumstances were I was shaving every 2 to 3, every couple of weeks. And so I began getting like razor bumps under my chin. And for me, that's a no-no. And so when I started getting razor bumps, I was like, I need to seek professional help because I felt like I was almost like hiding. So I like to laugh a lot. So when I was laughing, I was like, so I wanted to just go, So Dr. Diggs has helped that because I no longer have, as she would say, I'm not for sure if this is the correct wording, but pigmentation under my skin, but I no longer have the bumps or the dark spots, and it really has given me a better quality of life. I am willing because hopefully I can help someone else just to let them know that the laser treatment is painless. I personally don't have any pain with it, and to let others know that it's okay to get laser treatment and don't be afraid and don't be ashamed. I talk to a lot of my family and my friends about hair, coarse hair, and so they are really concerned about getting laser, and I like to tell all of them, please come join me on this fantastic voyage.